Now, I'd like to demonstrate and talk about the value of using a viscous submucosal injection fluid. In this case, we're going to use the Orise Gel. A lot of people in the community are still using saline, and the disadvantage of saline is that, first of all, it tends to diffuse laterally in the submucosa and in the proximal and distal anatomic directions, and ends up giving us a fairly broad, flat mound. What we want is a mound that is concentrated underneath the lesion and has a sort of dome shape to it. The other advantage of a more viscous fluid is that almost invariably the duration of the mound is longer than what we see with saline. So let's demonstrate that. We're going to use, again, our standard technique. So the first thing is just set it down on the location that we want to start our injection. And again, we've selected that location based on a strategy. And now we'll start the fluid into the tissue, and then just a little bit of popping motion will hopefully get it into the submucosa for us. Once we see the submucosal bleb, first thing we want to do is start to move away from the site. This is the process of what we call dynamic injection. And we actually can start to move the needle around, direct the fluid sometimes to the right or left, but also we need to pull back on the scope because the submucosal mound is coming toward the scope tip. And now the optimal position of the scope is going to be to start to move away from that submucosal mound so that we can see it developing. We want to see the lesion appear on the top of that submucosal injection mound. The keys, again, to this are to lay the needle on the site. Go ahead and put the needle out if you would. To lay the needle on the mucosa, and then before we insert the needle, start the fluid in. And then as we sort of pop in to the submucosa, that fluid coming out the tip of the needle will actually find that submucosal space for us. We don't have to search for it. The fluid will find it. Only the submucosa has that loose connective tissue that really allows the expansion of the submucosal mound. And then the dynamic part of this is the movement of the scope and the movement of the catheter to try to optimize the shape of the mound.